Uh, just to confirm, you guys can see my screen and you can hear me properly as well. There is no disturbance in the internet. If there is any disturbance, please let me know. My voice is clear. Okay, that's good. And you can see the screen as well, yeah? Okay. So today we have arranged this webinar to talk about communication. Communication is the most important bit of MRCPCH clinical exam. There are two stations, as most of you people know that there are two stations of communication, and each station is 9 minutes. And roughly talking about the communication station, when you are in exam situation, where you are sitting outside the room and you are reading your scenario, so you get around 8.5 to 8 minutes and 45 seconds. So whenever I'm teaching my students, I always tell them, whenever you are practicing with your colleagues, with your friends, try to finish the communication within 8 minutes, so that in exam situation, when you are in stressful situation, you can easily finish that communication in 8.5 minutes to 8 minutes and 45 seconds. So let's start. Generally, I would like uh, to make this interactive. You guys know how many type of communication scenario we can expect in the exam in MRCPCH clinical. What kind of communication they are bringing in the exam? If you want to write, or if anyone want to open the mic and they want to, uh, we have enough people, yeah. So, what kind of communication scenarios can come in the exam? Anyone?
The information giving education scenario, take a consent.
Yeah, breaking bad news.
Yeah.
Yeah, critical incidents, and difficult conversation, and others. So some of these communication scenarios, they might be mixed with each other. Like in some of the communication, you might be educating the parent and you might be taking consent at same time, or you will be giving information and then you will be taking consent, or you will be breaking bad news, you will be taking consent. So some of these communication scenarios might be mixed with each other. So the most important thing is, when you are in communication scenario in stations, sorry, try to read the task, what your task is. If the task is to explain the procedure to the parents and take consent, so you need to break the bad news. For example, if it is the child has been diagnosed with leukemia and you have to do lumbar puncture, so your task is to explain what the child has been diagnosed with and what procedure you are going to do. So always and always try to read the task at least two times when you are in exam, because sometimes we are in stress, we read it and we miss the things. So always try to read this task, what your task is. Try to write down the names. Like whenever you are in when you are in exam, they will be giving you pencil and paper. And ideally, as per the Royal College, outside each station there are supposed to be new pages available. So whenever you are entering any station, try to take a new paper, so that you are not messing up the stations with each other and you are not confusing. So try to take new papers and try to write down a patient name or the role player name, whoever in the exam, who you are talking to. Try to greet them. Try to introduce yourself. Recently I was doing a communication course, and the role player, I just said good morning, and before I can introduce myself, the role player started bombarding me with a lot of information. So I listened to her properly, I listened to whatever she was saying, and when she was done, I took a pause and I told her, thanks for all the information, but let me introduce myself, that who I am. So I introduced myself, and then when the feedback came from the examiners, it was written that you are a quite good listener, you listened to mom's concern, and then you did a very good introduction. So if in case you think that the role player is anxious, or she's typing continuously, so it might be something which has already been fed to her from the Royal College. If she's talking a lot, let her talk, because this is what the Royal College has told her, that you have to speak, and they want to see that what kind of listener you are. But if in case you think that the role player, she's talking rubbish and she's taking extra time from you and she's talking about things which will not add on to your communication, then at that point you can stop her. You can say that, let's talk about this, whatever your topic is, let's talk about this now, and once we are finished with it, we can talk about this later on. So if like your task is, he has been diagnosed with leukemia and she's talking about something else, so tell her, let's now talk about John condition, that he has been diagnosed with leukemia, and we will discuss about the other thing later on. Is it clear? So whenever I
Yes,
was,
doctor.
yeah, so when I was doing my exam, I was in UAE and I thought that it is just a drama. I don't know who in real life will be practicing all these things. But since I have come to UK, I have seen that it is what actually is practiced here. Like the normal waiting time for a patient when they come to the emergency, we expect to see a patient within 4 hours, and it sometimes goes up to 12 and 16 hours of waiting time. Patient comes to us, they sit with us, and we talk to them. We talk to them almost 15 to 20 minutes, sometimes 30 minutes, and in the end they go home without even a single prescription. So it's a routine here that you have to take history and you have to do communication with the patients and the in exam the role player. So uh, before we can go to the communication, we'll be doing practice. I would like to answer anyone, if you guys have any doubt about communication, I would be happy to answer the doubt before we practice some communication scenario. So anyone who want to ask about any question about communication by writing or by opening mic, I'm here to answer your doubts and to clarify your worries. So any question from anyone about communication? What doubts you have about communication? What's your understanding about communication? How much you guys are scared about communication? Because if I talk about communication, so most
Dr.
of our
Zahid?
candidates, yeah,
Yeah, I have one question. Sorry to disturb you.
no, please.
Actually, okay, thank you so much. So, actually, I want to ask when we are doing some communication and we are supposed to ask only one question, or we can ask more than one question. Like, sometime there is a situation that we need to ask a few questions because we are able to get their agenda. Because if we are not able to get their agenda, why, and we are not able to clear their queries, then it is not a good point. That's I want to ask from you.
Yeah. So that's a very good question, and many people they will say that you are not supposed to ask questions. So it's not like this. If the things are not clear and you're doing communication about any topic, and you don't know that in which way you have to proceed. So if you ask question, there is no any harm, but not a lot of question, because in the end it's not a history station. So I would limit, like if you are asking 2 to 3 questions, in that case, like the examiner will not cause any
Mm-hmm.
problem, will not detect any marks. But if you are continuously asking question, then it will be a
Mm-hmm.
problem, because in the end it's a communication. One question, some people saying it's a one question, some saying it's 2 question, but like there is no any hard and fast rule for anything. Like you cannot ask any question if you are talking about something and it's not relevant to the topic and you are not clear about things. So it's better to clarify the points rather than talking about it without like which is
Knowing
not
it.
adding anything to it. So you can ask up to 2 to 3 questions and it will not cause any harm to you.
Mm. Got it.
Yeah.
All right.
Yeah,
Thank you so much.
no problem. Any question from anybody else?
Hello.
Yeah, Dr. Sajid.
Hello, good evening, Dr. Zahid.
Can you please talk a bit louder? I cannot hear it.
Hello, am I audible now?
Yeah, it's a bit better now. Yeah.
Dr. Zahid, I'm quite confused about the non-accidental injury scenarios.
Mm-hmm.
Actually, I have gone through a couple of videos, even the Royal College videos, but in different videos, I have observed different patterns like involving of a social services or consultant. Uh, I have difficulties
Okay.
related to the non-accidental injury scenarios related to the admission of the baby and everything, and response of a mother.
Yeah. So non-accidental injury, these are the most common scenarios, especially you will face if you are appearing in exam in UK. If you
Yeah,
are on duty in the emergency, I would say like in every shift, you can expect that you will be at least seeing a one safeguarding or social issue or overdose patient. So a different role player will respond to you differently. In a non-accidental injury, the first thing is you have to escalate the things to your consultant. Your consultant has to be involved. If the mother, she is becoming anxious and she is angry, so it is pointing that she want to run away from you, then you would have to inform your social services as well. Social services should always be informed. When you involve your consultant, there is a consultant which is specific to safeguarding. So whenever you are facing a scenario with non-accidental injury, or if you have any doubt that this patient, the injuries are not persistent with the history, or whatever the mom is telling you, it's not going with the history, then always you have to think about non-accidental injury, because it's quite common here. But at same point, you cannot blame the parents or the mother or the role player completely, because if you will blame them completely, they might shout at you, especially in the exam scenario, because they are being trained. So you have to deal with it a bit politically. So you have to tell them that what you suspect, that you have found something which is not going with the history, or you are worried about the patient, so you want to make sure that everything is fine. So you will be admitting this patient, you will be doing certain tests, you will be doing certain imaging, and after that you will be in a better position to tell her what actually the patient or her child is suffering with. If it's a non-accidental injury, she will definitely try to escape from you. But if that situation, then you would have to tell her that if you have like she might tell that I'm getting late for my job, or I have other things to do, let me take my child with me and I will bring him back once I'm free. Then in that situation, you can offer her that it's okay, if you want to go, you can go and finish your job, or you can finish your work, whatever that is. We Let me reassure you that your child will be safe here. We will provide a safe place to him. We will involve our social services, and once you are done, you can come back. And by that point, we would have been done all the investigation, or most of the investigation, and we would have some diagnosis in place. So once in the communication, especially in the exam setting, once you involve the social services, at that point the role player will completely melt down, because they have been already told by the Royal College that once the social service is involved, they get scared from that, and then they come to your level and they will talk politely to you. So whenever you are doing communication about non-accidental injury, always and always involve the social services, if in case the parents are not listening to you, or they are giving you tough time.
That is either. Sorry for interruption. I want to ask you
No.
one more thing, that if
Yeah.
it is a case of non-accidental injury, like
Mm-hmm.
we have to straight away tell that we are suspecting the safety of the child is being threatened straight away, or whether we will take into the end and then we will tell that we are suspecting it. Like I
So
want to ask.
not, yeah, no, no, you don't have to tell them straight away that you are suspecting non-accidental injury,
Mhm.
because yeah, it's not like most of the time it will be the parents. Sometimes the child might be going to nursery. Like if it's a newly mobile child, like consider child
Mhm.
is 18 months, 18-month child, they always bump their self. So it's not
Mhm.
sure that it's not guaranteed just from talking from the beginning that it's a definitive non-accidental injury. So to make the thing smooth and run it a good in a
But
good way, you have to tell her
but
that.
as we will definitely say now, like clinical examination we have done, and we have found that like what we will say, like if we
Yeah, so
start from the yeah, yeah.
so that you have to say that you will say that we have examined your child and we have found something which is not going with the history and which is making
Mhm.
us worried. Yeah, so to make sure that your child is safe and everything is okay with him, we have to do certain other tests, and for that you would have to stay with us for a bit longer. So if in case
Okay.
you tell this sentence to her and she's saying that I have some other job to do, I have some other work to do, or I'm getting late for work, I'm a single mom and I have a lot of responsibility, I'm
Mhm.
suffering with finances, all these things, I will not go for a job and they will cut my salary. So if she's going in that direction, this means that it is a non-accidental injury. And then at that point, if she's giving you tough time, before you tell her what other investigation you would do, you can tell her that if you want to go, it's okay. You can go and continue your job. We will admit your son, or for example, John in the ward, and we have people who can look after him till you are back, and by that time most of his investigation would have been done. Some
Like
role player there's yeah,
like
sorry.
we can involve social worker in this case if she is busy in his work. We can involve social service who will take care of the child and the child safety as well.
Social service you have to always involve in non-accidental injury.
Yeah, yeah. Okay.
Social service, like 100%, they have to, you have to involve social services. But
Mhm.
yeah, but you have to make sure as well that it's a non-accidental injury, not like something like a child is having some pathological problem, so that's why you have to do bone scans, you have to do blood tests, just to make sure that he's not suffering from any bleeding disorder, or he's not having any orthogenesis imperfecta, or all these things. So you have to rule out pathological causes before labeling a child to have non-accidental injuries.
Mhm.
So I have a doubt. Before even finding out whether the cause is non-accidental injury or not, do we involve the social service before that? Before determining?
Like, if see, if the mother, she is agreeing with you at everything, like if she has brought the child with and you found something which is not persistent with the history, which is not going with the history, and the mother, she's already agreeing with you, and she agree with you that if you tell her I have to do certain tests, and she said okay, I want to admit the child, and she said okay, so in that case there is no need to involve social service, because there might be some other reason. Mother, she brought the child, but she's giving you history which is going with the child condition. That thing might have happened in the school, so at that point, like, you have to wait for the test and all these things. At that point you will escalate your consultant before going to the social services. If the mother, like in the exam situation, in exam situation, the role player will definitely give you tough time because they are trained so. But in real life things will be a bit different. So talking about exam situation, if she is giving you tough time, you have to escalate to social services. Is it clear?
Yeah. Thank you so much, Dr. Zahid. It's very good answer to that question. And just I want to add one thing. So
Mm-hmm.
it's better to. Can you hear me?
Yeah, I can, yes.
Yeah. So I think that the best sentence like you told that so we can tell the mother that yeah we did take the history and examination, but we are unable to reach to the conclusive diagnosis, and to reach that diagnosis we have to run certain tests, and definitely we are concerned regarding the child's safety, so that we are going to admit the patient, and we will run through different tests. So depending upon test we will better tell you what is the cause. So at that point, I think there are two things. First thing is that we have to be truthful and clear, honest. So it's I think it's component of the communication. And meanwhile, don't give the false hopes to the mother. And at the end, whenever you think that if the mother is not agreeing with your plan and she want to run away, then at that point you have to be assertive as well. Like you can tell that no, we're concerned regarding the child safety. We have to involve social services for that, and that's the pass fail criteria. The social services in a tough patient, you have to say
Yes.
so. Yes, it's the pass fail
Yeah.
criteria. Am I right?
Def- yeah, definitely. That's what I'm saying. If it's a tough role player,
Yeah.
because in exam it will be definitely a tough role player. If they are bringing
Yeah.
non-accidental injury, so they want to see your approach. So they want to see whether you are involving the social services or not. So in exam scenario, it will be definitely a tough role player. So especially if you are in UK, you are appearing in UK, you can expect that the role player will be much tougher as compared to other part of the world. So you have to involve the social services, especially in the exam situation. They will definitely not agree with your plan. They will always try to escape from it. So you have to involve. You are right, Doctor. Sorry, I forgot your name. Dr. Mazhar, I think. Yeah.
Yes. Yes.
Yeah. Yeah. Yes. And especially when you come to UK after MRCPCH, these safeguarding. I hate safeguarding these safeguarding things like. Uh, they are coming to the hospital so frequently. If you are an emergency on duty, you can expect that in every shift at least you will have a safeguarding problem, safeguarding patient, and you will have overdosing or a mental health patient. So and one mental health patient, they can take hours and hours from you, and other patient will be completely compromised. You have to arrange their social service. Like if you receive a patient of safeguarding in the emergency, you have to contact their social services. You have to contact the child, adolescent, and mental health service camps. You have to arrange a safe place for them if in case they are overdose and it's significant, you have to admit to the hospital. But if in case the levels of, like, most of the most common overdose which is coming to the hospital is paracetamol here and ibuprofen. So if they are not needing any treatment and you are sending them home, so parents sometimes they will refuse that we cannot provide safe place. On the other hand, if they are medically fit, the ward nurses, they will refuse to take the patient because we have limitation of space, limited beds, so we cannot admit the patient. So these kind of patient, it can easily take from you 2 to 3 hours arranging their social service referral, arranging their camps referral, and trying to arrange a safe place for them. So in in real life, I hate these non-accidental and safeguarding issues. Any question or any worry?
Dr. Zahid, just last question I want to ask.
Yes,
This
please.
non-accidental injury patient usually present with a delay presentation. Like I just want to ask you, as you are doing practical work, so as they will come, so they will give you history of delay present. Like for example, 2 days back something happened, or 1 day back, in delay presentation and history would not match. Like that, it is practical. You have seen.
So, things are different. Let me give a real life example to you. Last week I was in the emergency, and a 3-year-old patient, she came to me with parents that she fell at home, and she had a fracture. I think it was tibia or fibula fracture. I forgot now. So she fell down at home at 11 p.m. and then they came to emergency next day at 12 afternoon. They kept on waiting there, and then they were see around 2 to 3, and she had an X-ray, and we did X-ray. The orthopedic doctor, they said that this kind of fracture is not persistent with this history of fall. So I talked to my consultant. I involved the social services. The consultant came in. We tried to explore the history further, and like they presented almost 12 hours after fall. But what history they told us that the patient fell at 11 p.m. She slept nicely. In the morning, she wake up and she was complaining of leg pain. So they gave her some paracetamol, and the pain didn't subside. So then they came to the emergency. So there was a 12 hour of delay, because of which we involved the social services. But after investigating the case properly, the parents, they were giving same history to everyone, and it was going with the, like, the mother, she was holding the child was holding a toy. A toy fell from her mother. She bent down from the toy to pick the toy, and the child slipped from her hands, and she had a fracture. So we were suspecting a non-accidental injury, and we involved everyone. But after, in the end, we found that it was like not a non-accidental injury. It was an accidental injury which happened. But as the child slept nicely at night time, they gave her paracetamol in the morning, and they waited for the paracetamol to work. There was no obvious swelling in her leg. So they presented 12 hours late to the hospital, but it was an accidental injury. So sometimes it's not like guaranteed that if they are presenting late, so it will be definitively a non-accidental injury.
Yes,
Sometimes,
absolutely right. And
yeah, the
we
pay
you
the
yeah, yeah.
yeah, sorry.
I'm saying
Yeah.
nowadays in the books they say that this total fracture is basically accidental injury. So we usually read these things in the book now. But as you
Mhm.
said, you have done this, and practically you are suspecting, according to what we read, that it is a case of non-accidental injury, and then we came across that it is a case of accidental injury. So yeah,
Yes.
you're right. Yes.
Yeah, yeah. So like we involve everyone. Like we involve orthopedics. We involve. I raised to my consultant, because in practical life, if there is anything like social or safeguarding, being a registrar, I'm not authorized to go beyond my level. I have to escalate to my consultant, and my consultant has to discuss with the social service, because like for that case, uh, when we involve the social service reported to the police, and police also came. In practical life, the things are much more worse than the exam situation. So once you raise the things to social services, especially if they are out of hours, so the social service, they will call the police. The police will come to the hospital. They will talk to you. They will take the details, and while the patient is in there, they will take one of the parent. they will go to the home and they will visit their home with 1 hour of safeguarding consultant, and they will see everything in their house, that how the things are, how the child is sleeping, is the child having a safe place at home or not. So they will do a full examination of the house before they are coming back. The social service and the police, before they come and talk to the parents in person, they will have a complete look of their house. So in real life, these safeguarding issues and non-accidental injuries, they are a bit different than what we practice in the exam.
Yeah. Okay, thank you, Dr. Zahid.
No problem.
Dr. Zahid,
Yeah.
so we in NAI we will inform the consultant, and consultant will involve the social services. So will we need to involve the safeguarding team before going
So
to the social service?
So this is in real life when you are doing communication. In communication, you when the parents, sorry, the role player, they are giving you tough time, you have to tell her that if you are not agreeing with me or if you are not going with my plan, I'm afraid I would have to raise this concern to social service, and the social service need to be involved. So in communication in the exam situation, you have to tell her social service. You have to warn her about social services, not about your consultant initially.
Oh, okay.
Yeah, yeah.
Thank you.
Sorry, doctor, can I ask? So
Yes, Dr. Abdullah.
otherwise, if the role player is cooperative and she is listening well and she's listening well to our plan, what investigation we will do, what bone scan we will do. So no need to raise to even mention the social services for the role player, or
That, yeah. So if in case she's like, see in even if in exam or if in real, so if there's a non-accidental injury and the parents, they have,
only.
yeah, yeah. So if they have made these harms to the patient or to the child which is bringing to you, so they will not agree with you. But if in case they are agreeing with you, so definitely they are not wrong. They are fully satisfied that they haven't done anything wrong, they have not harmed the child. So if they are agreeing with you, so then you have to look out for the pathological causes before escalating the thing to the social services. But if in case she is not cooperative, then that thing, like, you have to raise, like, if she is coming, if the child is going to nursery, so maybe something has happened in the nursery and the parents, they are not aware of. So in that point, then you have to look for the pathological causes first before raising the thing to escalating the thing to the other agencies.
sorry, doctor, but if the scenario outside
Mhm.
the station, if the scenario is written in details and says that there is bad environment for the baby at home, at that time, uh, must we mention the social services, or must we let the patient just to know that we are suspecting something non-accidental happened? This is my
So if
question.
it is, yeah, if it is clearly written in the scenario that there is, like, for example, her partner, because they hear the partners are changing quite frequently. So if it is written that her partner or his partner is implicated, making these injuries or making these things, then you would have to involve the social services definitely. If it is clearly written in the scenario that it's a non-accidental injury, then you would have to escalate to social service. You have to involve, before you escalate to the social service, you have to involve the parents or the role player as well, that what your next step is, because they need to be aware that you are escalating the thing to social service and you have to see their response as well. Is it clear, Dr. Abdullah?
Yes, thank you. Thank you very much.
No problem. No problem. So if you got a communication scenario, and in communication scenario, it's clearly mentioned that this is a case of non-accidental injury, then even if the parents, they agree with you, you have to tell them that these are your findings. Because if you are given finding that the findings are not consistent with accidental injury, but they are non-accidental injury, then you have to tell that you will be involving social service. But before involving social services, you have to tell them that what your next step is. You have to keep them in the loop, that what your step, not to keep them in dark. So if you are involving social service, you have to involve tell the role player or the patient or the parent, whoever it is. Okay. Sorry, just 1 minute, I will be back. So I think Dr. Tabuhi was supposed to do the communication. I don't know if she's here or not. Sorry, someone is. Okay, you can take her. So, Dr. Sabui, I was given some names who has been volunteered through the communications. I don't know if she is here or not.
Yes, Dr. Zahid, I'm here.
Yeah. You can see the screen, yeah?
Yeah.
I can start your timer. You can
Can you hear
prepare
me?
it.
Okay.
Yeah, I can hear. Yeah. Yeah.
Okay.
Ready?
Dr. Zahid, can I share some
Yeah.
picture in the group?
Yeah, sure.
Okay, I'm sharing in the WhatsApp group.
Okay.
Just to trying to explain to the mother.
Okay, sure. Yeah.
Need correction if there is any. please.
Okay, about drawing, when you are
Just
drawing, so yeah,
yeah, just
uh,
rough drawing. Okay.
yeah. So draw anything, just draw lines, because
Yeah,
in the end, the
just
examiner,
to
he want to just want to make sure that you are good in explaining. So he might be sitting quite apart from you. You will be facing the role player in front of you. So draw, because in the end, when you are leaving the room, you can take that paper with you and you can throw in the dustbin, or before exiting, you can throw in the dustbin. So try to draw anything when it's possible for you to draw in the communication.
yeah, I shared in the WhatsApp group. So
Okay.
can we start?
Yeah, sure. Just
Helen
1 minute. Yeah.
was mother of
Just,
Louis.
yeah. Yeah, you can start. Yeah.
Mm. Hello, good afternoon.
Good afternoon.
Am I talking to Helen, mother of Alexander, 4 years old boy, admitted with us?
Yes, doctor. I'm Alexander's mom.
Okay, nice to see you, Helen. The first, I'm Dr. Subuhi. I'm one of the child doctor working here in this ward, taking a part of the team who is taking care of Alexander.
Thank you so
Do
much,
you
doctor, for
know
taking care of
any?
Alex.
Thank you for you also. You came here and to discuss about Alexander condition.
Yeah.
You know already Alexander has been admitted to us in PICU, and you have any idea that we are suspecting something like he has having a uh, infection which is affecting his brain. Do you know? You have any idea?
I don't know about that he had got brain infection, doctor. But when last time I spoke to some of your friend from the team, they said that
Okay,
he's
okay, no
having some
problem.
kind of
It's
infection.
okay.
Yeah, he's having some kind of infection from a layer which is surrounding the brain and it's protecting the brain. It is called some, yeah. So that layer, I think they said that that layer might got some infection. So he's got some brain infection now, or what?
Okay, Helen, just let me explain to you. You know, Alexander is here for last 24 hours in PICU, as he was not conscious and he was having fits and he was having fever also, high grade fever, you know.
Yeah.
And now his condition is a little bit better than before. You know, this type of illness is, we call it meningitis, you know. About this, I will explain you in detail also later on. Right now, I'm here to discuss with you something about that we want to have some test on Alexander.
Yes, doctor. Like,
Are you with me?
what kind of? Yeah, I'm with you. What kind of test you want to perform? Because I can see that he's getting better. I think his medicine is working. So, is there any other test need to be done?
Yeah, actually, I appreciate your concern. Actually, you know, for meningitis, there is only one test which is specific for this to be sure, and that is we call it lumbar puncture in our medical term. For you, I will explain it to you. Actually, we are going to insert a little small needle in his backbone. We will go to the spinal column. I will show you some diagram also. I will try to explain, try my best to explain it to you. We will take some fluid from there, a little bit of fluid only,
Doctor, you are going
to
to put a
make a
needle in
test.
his back. If you are going to put a needle in his back, it will be quite painful.
Backbone.
Yes.
I understand you are his mother. I appreciate you. I know it will be painful, but we will do the procedure after we will sedate the patient. I mean Alexander. We will sedate Alexander first. Then also we will apply some gel or some solution to make his skin numb, so that he cannot feel any pain.
Yes, doctor, but like as I said that he was initially, as you said, he was in PICU, PICO, and now he's stable and he's transferred to the ward. So I believe his medicine is working and his condition is improving. So like, what's the need of doing this dangerous test in which you are going to put a needle in his back?
Yeah, I totally agree with you that his condition is improving. And you know what is for this procedure, actually, when the patient, once the patient is not conscious and having fits and inactive state, actually we cannot do this test. We have to wait for certain time to become patient to become a little bit stable.
Yes, doctor, but
Fine.
my question is like, yeah, what's the benefit of doing this test now if he's improving?
Yeah, this question is very valid, Helen. This benefit of this will be that it will give us a sure and confirmatory information about meningitis and which medicine we have to use for which type of antibiotic we can use. If we have to make a change in the medicine, or we can get the exact information about the drugs we have to use. So if it report comes negative, then our duration of treatment will be automatically reduced. Otherwise, we have to complete the, if it's positive, we have to complete the treatment. If yeah, you
Yeah,
want to ask
and
anything?
like, yeah, what are the complication? Like, if you are doing this test, like, what problem he might have from this test? Like, is there any complication or any side effect of this test which you are doing? The lumbar
You
puncture, I
know,
think, which you're saying.
yeah, Helen, every procedure carries risk, but we are having a team of expert people. I assure you that we can do the procedure under complete aseptic measures, but a little
Mm-hmm.
bit chance of can be we can get a failed procedure, or we can get blood in that. We can introduce any infection, but the
3 minutes
chances of
remaining. 3 minutes.
complications is still low as compared to the benefit of the test.
Yes, doctor. Yeah, I can understand that, but I get sometimes scared. Like, it's a quite difficult procedure, putting a needle in the back.
Yeah, your concerns are valid. I completely
Yeah,
understand
doctor.
you.
Like,
But
yeah,
this
there
will
is also,
quite, yeah.
like, if you are putting the needle, there is also spinal cord there. So, is there any chance that it might get damaged as well?
Actually, we will introduce only a little needle, the smallest bore, which will not just for the few drops of the liquid. It will not put any harm to the spine or to the backbone.
Okay, doctor. That's fine then.
Okay, Helen, if you want some more information, I can provide you with some leaflets, and uh, I can provide you further more information if you have any question so far.
Well, I will need some time to discuss with my partner.
Yeah, okay, you're right, but it's your right to discuss with your family as well. But for this procedure, we have to do it as soon as possible. So if it's better if you will give us consent at the earliest.
Uh, yes, doctor. Yeah, I will try to get back to you as soon as possible. Yeah, but I have to confirm with my partner because
Thank you
it
so
seemed
much,
to be
Helen. You
quite
understand my
yeah.
point.
Yes,
Uh,
it's quite a difficult
can
procedure.
I
So
discuss with you? Yeah, I know,
yes,
I understand you.
yeah,
Can I give you a brief information once again if you want?
yes, sure.
Yeah, as I told you that for Alexander, we are going to undertake a small test, which is lumbar puncture. We will introduce a
Mhm.
small needle in his spinal cord, and we'll get few drops of liquid from there to get confirmation of the this illness. Okay,
Okay. Yeah.
are you with me, Helen?
Yes, doctor. Yeah, I'm with you.
Okay,
Yeah, I'm following
so
you.
I hope so you will give me. I will bring documents. I'll bring some documents, and I'll get your sign.
Okay,
Okay.
doctor. Okay, that's fine. Okay, okay.
Okay. Thank you so much, Helen. Thank you. Thank you for your
Thank you
time.
so much. Thank you, doctor. Okay, time finish as well. Almost. Okay.
Okay.
Yes, Doctor
Okay.
Sabuhi, and anyone who want to comment.
Yes, I want to comment.
Yes, please. Just yeah.
Yeah, first of all, You were so nice being
A role
the
player.
mother. Role player, usually the role
Yeah,
players, they are not
yeah, actually.
nice as you were. They are a bit harsh. So we will start from the good things. So good thing was that sorry, sorry, just I will go some background because back home in Pakistan, first of all, our consultant they will start from from the bad things what you did in examination. But here I'm working in Ireland, so here the good thing is that the people always encourage you what you did good. So later on they will comment on the things that you have to do. So that's why we started from the good. So the good was that she was very empathic, and she introduced her well. And at the end, she asked uh, for the summary what we have discussed, and she definitely asked for the literature uh, to be given to the mom. So the things that we need to work on, that first of all, so we have to introduce first. So she introduced her later that my name is this and I am one of the doctors. So initially she said hi, hello. So after that, she introduced herself. So I think the first of all you have to introduce yourself. And a second important thing is before jumping on to breaking the bad news, like whatsoever, yeah, get the consent. Try to build a rapport. Maybe two or three words are fine. How are you? How are you? How are you are doing? How the things are, to just a bit familiar with each other. Then one thing that you can ask, you can tell in the beginning that we have. So what is the purpose of your meeting? You can tell the mother that we have arranged this meeting. This is a separate room, and no one will disturb us. And then you can say that because there will be a father for the Alexander. So you have to ask that, mom, are you okay alone, or do you want someone else to be with you at the moment? Just to have another person in the meeting to make the things easier for the consent, like the partner. Next thing is always give time to the mother. Once ever you are talking to the mother, giving the information, and in between the information, just take some pause and allow the mother to talk to you in return. And meanwhile you have to check, like, are you with me? Am I clear so far? Is that okay?
Yeah,
Then
okay.
in yeah, then in the end you can tell that because the mom was asking questions, and because what's happened, I will tell you what happened with us, because English is not our native language. So what happens, so whenever we are discussing something, at that time we are not listening to the mother. We are thinking ahead that what we have to ask next. So this is the issue that's frequently happening with all of us,
Uh,
that we are jumping ahead. We are not giving attention what the mother is saying. We are thinking about what we have to do next. So always try to understand what the mother is saying and address the things at that time. Because this is not uh, a test of your knowledge. This is a test of the skills that you have to perform on that station. And that's it from my side. Thank you.
Yes,
I have a
very
doubt.
good comment, Dr. Fazal.
Yeah, I have a doubt regarding his comments. We were told in one of the earlier sessions by Dr. Maimuna not to ask very open-ended questions like "How are you?" because the role player might just go on and say a story and a lot of things that might will cause a waste of time. That was what we were told. Rather, you can ask about the well-being of the child, like how is your child doing or something like that. So is that so? I just wanted to know.
Yes, Dr. Tanu, this I will agree with you because previously it was like, couple of years back, it was a common question. The candidate used to ask that, sorry, how was your journey to the hospital, or how are you feeling? So in that response, the role player, sorry. So in that response, the role player started to have a lot of drama, like, oh, it was terrible. I had to take taxi and etc. etc. So it used to waste quite a lot of time. So the things have been changed now. So it's better and wise not to ask unnecessary thing like how was your journey to the hospital, how you are feeling. So you have to check understanding like what her understanding about her child is, because that's our task, rather than asking about her health in particular. And especially if you are sitting in the UK exam, so these role players, they make a lot more drama as compared to if you are sitting in UAE, in Gulf countries or any other part. These role player in the Gulf and other part, they are like just sitting in the office and just explaining something to the patient, and then
Hello.
MPCH clinical exam communication with a role player who is already practicing all these things on day-to-day life on routine basis. So if you ask these questions from him and then he start to make a lot of drama, so it will waste a lot of your time. So it's better to be on the track, and then asking unnecessary question will add extra stress and extra burden on you. uh, Dr. Mazhar here add a lot of things. One thing, Dr. Sahu, I would like to add. So meningitis, you said it's a brain infection. Try to use your words wisely, because that day I was doing communication with someone, and they said I was doing a PD, and they said hole in the heart. So meningitis is not by itself. It's not in infection in the brain. So it is the layer, the meningeal layers, which is surrounding or protecting the brain. They gets infected, because having a meningeal infection and having a brain infection is totally different thing. Yes. You didn't check understanding of the mom, that yeah, what her understanding is about uh, Alexander's condition. And when you said that you are going to perform a lumbar puncture, you should have asked, we are planning to do a test which is called lumbar puncture. Have you heard about this before? So if you would have asked me, I might have told you that yes, I know about this test, because when I had my cesarean, so they put a needle something. So always and always when you are explaining something to the role player, try to ask what's
Okay.
their understanding is about that condition. It will give you a lot of information what they know, and then you can carry on from there. So as you said that you are going to perform a lumbar puncture, you should have asked what's her name, Helen. So Helen, you know what a lumbar puncture is. If she knows that what lumbar puncture is, well and good. If she doesn't know, you should have started from there, that let okay, that's fine, let me explain to you what lumbar puncture is. I will try to draw a diagram as well to make it a bit easier for you and make it more understandable. Okay. And the needle, so the needle is put in the spaces between the bones in the spine, and it will not affect the spinal cord because it's inserted a bit lower. Spinal cord ends finish higher to the level where we are putting the needle. So it is very less likely that the place where we are putting the spinal cord, where we are putting the needle, it will damage the spinal cord, because normally spinal cord finish a bit higher than where we are putting the needle. Yes. And yeah, one if you think that I know doing a communication face to face, sitting with someone and doing communication on a computer where you cannot see each other, so there is some distraction. Two people start talking at same time, but especially when you are practicing with your colleague, I would always prefer to use an open camera, see their faces and see their expression, try to maintain an eye to eye contact and see how they are talking. And if you think that in the exam situation, or if you are practicing with your friend and they're trying to say something, let them finish their sentences. Always try to be a good listener when the role player or the patient they are talking. Okay. Any question from anyone about this communication? Any doubt or any worry?
Yes, excuse me, Dr. Zahid.
Yeah.
For this, I was not sure. I should give information about meningitis. Also, I should directly start from the procedure.
Okay. So after doing introduction, greeting her and asking her if she wants someone to attend with her this meeting, or and like Dr. Mother said, you have arranged this meeting that so no one can disturb you. So then you should have asked that what you know about Alexander condition so far. So that should be your starting question. Always when you are doing communication, try to ask the role player like what their understanding is about the condition. So you should have asked that what's your understanding is about Alexander condition. So if you would have asked me this question, I would have told you that yeah, we brought him in quite poor condition. He was quite poorly. He was having jerking movement in his body. He was having high temperature, and then they told us that he's having some kind of infection of the layer of the brain called meningitis. So if you would have asked me that what my understanding is, so I would have told you most of the thing. So you would have easily skipped that part rather than going and explaining to me meningitis.
Okay.
Yes.
Okay.
So then yeah, then you should have like if you would have asked me this question, it would have made your life much easier. So you would have then gone, as you know that he has been diagnosed with meningitis. Once she has explained to you what meningitis is, then you can easily use the word meningitis as well, as it has been explained. So it is no more terminology you can avoid. So you can tell like, as you are aware that Alexander was having we are treating him as a meningitis, but to make sure that we are treating him with the right type of medicine and his condition is correctly diagnosed, we are going to perform another test, and that test is called a lumbar puncture. Have you heard about this before? So
Okay.
let her explain to you what her understanding is. So it is kind of like you are trying to give her information, but at the same time you are asking her a question as well. So like when someone asked previously whether we are allowed to ask questions. So this you are trying to explain to her, but before you want to, you can explain to her, you are checking her understanding as well. Because if she already knows what a lumbar puncture is, so if you are going to explain everything to her and she knows about lumbar puncture, so it will be just wasting your time, and it will be like you are wasting your precious time in the exam. So try to check her understanding what lumbar puncture is.
Okay.
Okay.
Yeah. Okay. Thank you.
Yes,
And
and yeah, so
the most important thing is that what mistake we people usually do, we usually say a lot of things of the medical jargon. So just avoid the medical terms and just be layman as much as you can.
yeah, and if in case you use it, so try to explain it to her that what
Explain.
that condition is.
Yeah.
Yeah. So yeah, so like as you draw in the diagram quite nicely, but yeah, if you say that you will be inserting the needle, or you will be putting the needle in the spaces inside the bone, so it was not something we are going through the bone. So it is the spaces where you are putting the needle. So it is a painful procedure, but for to minimize the pain. So in UK, things are tried differently. Like we sometimes put the numbing cream, which is very common here. Sometimes we give like a chlorohydrate, or if in case the patient is quite anxious, or it is not possible to do it while he or she is awake, so then we involve the anesthetist team as well, and we do with them under their supervision, and they help us with sedation and all these things. But this is just yeah for general knowledge. No need to go in detail with the parents or the role player in the exam. So yes, you will be taking pain management measure that might be in the form of giving him or her some medicine through the mouth to make him a bit sleepy, or putting a cream on his back which will make the area numb and minimize the pain. Okay.
Yes. Okay.
I think there was for next candidate was Dr. Jan. I don't know if she's here or not. If she's not here and anyone want to do the next communication, they can volunteer. The next is a bit easier one, but it will be good for those who are appearing in the UK. The next scenario, it is more of a UK kind of scenario. So anyone who want to do the next one, more than welcome to volunteer for that. Dr. Jivantika, you want to do it because I see your mic is open.
Yeah, it's okay, Dr. Zahid.
Okay. Yeah. Okay. Because I saw your mic open, so if you have volunteers, so that's fine. This is the communication. The next one, you can read it. I can give you time.
Okay.
Dr. Zahid, I will be a role player.
You want to role? You want to be the role player?
Yeah.
Okay, sure. I can keep the time, and it will be
Okay.
easy for you because these are the things much more common in the UK, I would say,
Yeah. Yeah.
in Ireland as well. Yeah.
So just a suggestion, like those who want to do the, you can keep their videos open so that we can, have an idea, as you
Sorry.
said.
Sorry. You mean the camera open? Yeah.
Yes, yes, so that is much better that way. Those who
Yeah. Sure.
present.
Yes. Dr. Fatma, there is not much difference. Most of the things they are going from UK as the exam is central, so the scenarios they are sent from here. But the safeguarding issues, uh, non-accidental injuries, dealing with difficult colleagues. So these kind of things are they are quite common here in the UK and they are quite frequently encountered. So uh, but I think that very less likely you will be seeing a safeguarding communication in the UAE or in other area. Like it's not like it will not come, but there is less possibility of this kind of communications to come in Gulf and MENA area, like safeguarding, overdosing, non-accidental, difficult colleagues. uh, they might come, but like they are very less likely to come in this part of the world, but in UK they are quite common.
Can I start now, Dr. Zahid?
Yeah, it's 1 second, I will reset the time. Yeah, Dr. Mazhar, you are
Okay.
ready?
Yeah, I'm ready.
Okay, you can start if you want. I will start the timer.
Hi, Dr. Michael. You already know me. I'm Dr. Jivantika. How are
Yeah,
you
yeah.
today?
Yeah, I'm fine.
So, you know that we have been working here for last, I have been working with you last 3 months time. So how are you feeling about your job at the moment?
Yeah, it's fine. Sometimes there are some things and, ups and downs are part of life. So coping with it at the moment.
Okay, why do you say that coping at the moment mean?
Yeah, there are some things, going on with me in my life. So I have to manage these things as well and doing the job as well. So, the job is also a stressful job and sometimes it's difficult to cope with it. But I'm doing it. That's okay.
Okay, yeah, it's nice to hear that. So, and so how your colleagues say about you? Actually, recently I got to know that uh, I don't know, this is, but I want to talk with you. Some says that you are uh, late for some time to the work. So actually, I'm here to discuss it with you and to talk with you about this and what's your problem here and how we can support to you with that. So do you like to talk about that? So sometimes you might have heard from your colleague and staff about being late for the working.
Yeah, I know people are talking in my absence, and I know them. But the thing is that I have to drop my kids at school. So as my wife, she don't know how to drive. So that's why, because we have to come to the office at 8:30, but I have to drop my kids at 9 o'clock. So that's why I'm a bit late, but no one is understanding my circumstances. They start talking in my absence. But I am finishing my work, and I have not never left my any work unfinished. But still, they have issues. I don't know.
Yeah, I can understand that's actually your working is okay, but sometimes we have problem. We have to be uh, work here according to protocols and things. So actually, we can look into your problems. You said that you have problem with kids, so I think it might be worth to discuss with your school, because sometimes they have these early morning clubs and things. You can put your kids like that. I mean, this is a suggestions, because sometimes you know that we have to follow the hospital rules and administration rules. So uh, repeating sometimes being late to work, that it can affect our career. And but as colleagues, so we actually, I would like to support as much as I can. And uh, I suggest that if you would like to, you can grab a coffee and discuss this matter later. And but I can understand your
Yeah,
family
that's okay.
situation as well. But here, actually, if you have any problems, you can say it to me, and I'm
No,
open to any
no, thank you.
discussion.
Thank you. Yeah, fine. Thank you so much. You have offered me a help. So you're very kind. Thank you so much, and I will try my best to make the things better.
Yeah, that's
And
really nice to hear. You know that every time we are here to work together and support each other. So sometimes I also mother, I have this problem with me about kids. So we can find some solutions. And actually, I think sometimes I put my kids to a school morning club. So usually school begin at 8:30, 8:45. You know that, but clubs are open at 7:30. So actually, I use that option. And of course, you can help with your wife to get driving license as well. So if you have
yeah,
any problem,
I'm working on it. She's a bit lazy and she don't want to drive. So
yeah,
I'm trying on
sometimes
it, and yeah,
sometimes it's like that. But sometimes if we don't have any other options, we have to do that. So I think it will be
yeah,
really helpful for you. But if you have any problem with your work here and subject matter, we can help with, and we can discuss together. And always I'm open, and you can tell your problem with work here. But though we have problems, it's not good for our job to be in work late. Now I know your problems, and but I think we can try it to that these settings is quite difficult and stressful, as you said, and it's same goes with me. But in this we can have anytime emergency situation. So if we are on time to our work, it will be really important. So I think you are really nice, and hereafter you will be uh, working on time. So I'm really sorry to say this, but I'm always here to support as much as I can. And
yeah.
we all are
Thank you for
so
your yeah. You're yes. Thank you so much. You're so nice, and thank you
Three
for
minutes
suggestion.
remaining.
I,
Three
I
minutes.
will work on that. Yeah, I will work on that, and I will definitely discuss with the school. regarding these things. If they allow me, then I will drop the kids at my earliest, and I can come to the hospital on time.
Yeah, it's really nice to hear that, and I really thankful you. Otherwise, sometimes I also have some pressure from the staff, and it's working together is sometimes it's very helpful for our career. And if you have anything that I can support, and if you have any problems, so we can help with, and we will find solutions for that. So thank you for being open to me, Dr. Michael. Actually,
Yeah, thank
okay. I really appreciate that you agreed to be on time for work. And if you need any help, if subject matter working, please let me know. We will
yeah,
find.
that I will definitely I will definitely.
Thank you, Michael. Thank you.
Thank you.
Done? One
Done.
I
minute
hope
in.
so, Dr. Said.
Yeah. Okay. Yes, Dr. Mazhar, and anyone who want to comment.
Let other
That-
people comment first, then at the end we will discuss.
Any comment from anyone, or Dr. Jevantika, if you want to add anything, how you felt.
Actually, Dr. Said, as you said, that this seems to be very easy task, but I don't know. I haven't done task like this before.
Hmm.
But I think, according to my experience, we usually talk normally and sincerely, and to convince what we want to do. It's not like strictly adhere to protocol, and sometimes we need to think in the human perspective. So that's how I talked to Dr. Michael today. I don't know how it
Hmm.
was.
Okay. Yes. So yeah. Anyone else? Anyone want to add anything?
It appeared
Dr.
somewhat.
Hamza, Dr. Hamza.
It appeared more of a monologue than a dialogue. Like he was talking for too long a time, and maybe talking only for 30 seconds should be the norm, and check the understanding. I felt it was like monologue kind of conversation.
Okay. And yeah, I don't know if anyone has done such communication before or practiced such situation communication in as a practice or in real life. Anyone of you has done this communication?
Actually, I have many colleagues that who are being late to working, but it's always sometimes family problem and things. It's not like they really want to be late, and some but most of time it's about that family commitment and things. But after having some discussions and helping each other, we overcome
Yeah.
these issues. This is the normal situation in my country, so
Yeah. No, so coming late for duty once or twice, that's fine. But when the things become habitual, so this is where the problem starts. Dr. Mazhar, if you want to add anything. So normally you can see the screen, yes? So for such kind of scenarios, we follow the mnemonics called SPICE. You can see the screen, SPIES. So whenever you are doing communication with a colleague or Dr. Mazhar, you want me to talk about it or you want to give your comment and then whatever suits you?
Yes, Dr. Zahid. The
Yeah.
important thing is that she did the introduction and she built the rapport. Definitely, she was my colleague, so she knows me, and she don't have to work on that because. And the thing is that we have to work on, because it's usually, it's definitely a common scenarios here, but in other part of the world it's not very uncommon, and people don't want anyone to talk about their being late, and they get offended easily. But here the things are
Mm-hmm.
very different. But as our previous colleague said, it was most like a monologue rather than a dialogue. Yeah, I agree with that. Just give some time after you deliver your message, one message, and after that message you should wait for your colleague, the anyone who's with you in the dialogue, and what is their say. to know that. And also, keep asking that, are you with me? Are you with me? Are you getting me? So these like of things. But she did very great, and she was very empathic. She was very supportive, being colleague in the communication, and she was many times she was asking for help. What sort of help can being a colleague can do? So she did very well.
Yeah. Yeah, so yeah, it was a good start. I know you might have not practiced this before, so you check this. So let me talk about this mnemonic. So you can see the screen, yeah. So SPICE is S is for situation, P is for patient safety, E is for initiative, E is for escalate, and then S is for support. So starting from the end, S. So she look into the situation, she dig into the matter, and she try to understand what Michael's problem is, why he's coming late for duty, which was his which was his kids' school problem, which was causing the problem. But one thing, Dr. Javantika, you totally ignored, and like it's considered to be a crime. You didn't talk about anything about patient safety. That's most important thing. Like if you do anything here, but you're not talking about patient safety, so this is not considered right. So you have to make sure that patient safety is not compromised. Like Dr. Michael, he's coming late for work, even if he's coming every minute 15 minutes late for work here, uh, at 9 or 8, like the duties, for example, if starting at 9, our shift is starting at 9. In my previous test it was starting at 8. So if it means 8 or 9, so 9 mean then at exact 9 or 9:01 the handover will start, whatever the situation is, whoever is present, whether all the team is present, half of the team is present, or nobody's present, the night team will start the handover in the presence of anyone who is present in the morning from the morning shift. So we start our handover at exact 9. So it is 9. So we have to make sure that the morning shift, the team who is on duty in the morning has to be present from 9. So if someone is coming continuously late even for 15 minutes, so this means that he is not attending the handover completely. He is missing important bit of the handover, which might be compromising the patient safety. He might miss something which he has to do. Like for example, he is the SHO. He's the on duty SHO. He's carrying the bleep, and there is some patient who he has to refer to. For example, we are referring to Birmingham Children's Hospital. So if he has to, this is his responsibility because he's carrying the bleep, and he's responsible to call Birmingham Children's Hospital about this patient, and he missed this patient handover in the first 15 minutes, and he is coming late every day, 15 minutes late. So if he missed this patient and the care of this patient is delayed, so this is compromising patient safety. So you have to tell Michael that I can understand, Michael, you have a lot of responsibility, but we have to make sure that patient safety is not compromised as well. We have to make sure that patient, sorry, someone has written a message. Yeah, so the mnemonic is SPICE. S is for situation, patient is P is for patient safety, I is for initiative, E is for escalation, and S is for support. So whatever situation you got from Michael, you are here to support him, but you have to emphasize on him that due to his delay coming, his because these communication might come in the way that either he's coming late for work, or he is missing the notes, he is not completing the notes, he is lazy in finishing the discharge summaries, he is not answering the bleep. So these difficult communication or the difficult colleague communication scenario can come in different way. It will mostly come for us in Mrcpch as we are dealing with SHOs, and sometime it will come as coming to our same level as a registrar. If you are appearing in ST3 pediatric interview for the training, it might come for a consultant as well, but for us, we will be taking ourselves to the SHOs and registrar. So you have to uh, you are the boss at that situation, so you have to ask them like a boss, making them comfortable. And once you have checked their situation, what the situation is, you have made sure that patient safety is not compromised, then it's come to what is initiative, what you can do at his level, at your level, sorry, what initiative you can offer Michael. So like Javantika offered him that you can teach your wife how to drive, or you can send your kids to school, to early clubs. There are school clubs which start normally 30 to 45 minutes or sometime before the school normal time. So that what initiative Dr. Jayantika took that. After initiative, then the E is escalate. Here is a trainee or a non-trainee, we have like education supervisor. Education supervisor is the consultant to whom I am responsible to report directly. Like every doctor, they have an education supervisor. So like I have a named education supervisor. If I do a mistake, other consultant, they will not come directly to me. They will report the things to my education supervisor, and it will come to me through my education supervisor by coming and talk to me or calling me or whatsoever. So the thing is escalate. So you have to tell him that as he is coming frequently late, or he is missing notes, or he is not answering the brief, as these things are compromising patient safety, so you would have to escalate the things to education supervisor. This is, I'm talking about these things because these uh, SPIES will be taken in your exam when you are doing these kind of communication in your exam. So you have to talk about education supervisor. If the things are like Michael is quite stubborn, he's not talking to you, and he said that who the hell you are, that you are wasting my time, and he is not sharing anything with you, then in that situation the things will go to education supervisor and the clinical lead. Clinical lead is the head of department, which is controlling, like head of department, other places is called head of department, but it's here it's called clinical lead. So you will have to escalate it to the education supervisor, his education supervisor, and the education supervisor, if things it's necessary, he might escalate to uh, clinical lead. And then there is one thing, if you are a trainee, then there is a training supervisor as well, who is like in general your supervisor for whole of your training. But for us, for MRCPCH level, it's enough to escalate it to education supervisor and the uh, what is called the clinical lead. Then as support, what support we can offer to this, to Mike or anyone who is coming late for work, or who is missing notes or not completing the notes. So being as a department, what support we can offer him? Like if Michael is falling, Michael uh, kid school is away from his home, so it's possible that we try to get his school admission to some place which is near to his house, where it will be convenient for his wife to take the kids to school. So what as a department support can we offer? Like if he's in stress and he's in need of some time out of the work, so is it possible for a rota coordinator to give him some off? If he is new to the trust and he don't know how to use the system or how to write the notes, so is there any course which we can provide as a department to support him so that he can understand the system and he can make his work better? Okay, let me go to the messages.
Can we also say that he could contact the rota coordinator to change his shift till the matters are sorted?
If he go from morning to night shift, it will again be a problem. He will finish his shift late, which will be a problem that he cannot reach to his kids to drop him to school. So in this situation, the best support will be like if it's possible for him to change this kid's school, which is like here we get school in catchment area. Like we have certain like if my house is in certain area, so I have certain school which are coming in my area, and which is supposed, like these schools are easily approachable by walking to their school, not by driving, especially if their kids are in primary school up to year 6. Year 7 they are a bit far, so they have sometimes they can sometimes go by walk, or sometimes they have to take bus, or sometimes if the parents they have car or they can drive, they can drop them. So rota coordinator in this situation will not be of any help, yes, but the support you can give them, like you can ask the hospital administration to write a letter for him to the council if it's possible for his kids to be admitted to a school which is near to his house.
Who will write this letter, sir? What did you say?
This just like if you a support from the host, the clinical lead, he will like to the medical workforce or HR or the hospital administration. This I'm just like in the exam you have to make drama. In the end, no one will listen to that later, but you have to make drama that let's discuss the things with your education supervisor and our clinical lead, and let's try to get a letter from them, and we will send that letter to the council, and we will try to arrange a school for your kids which will be near to your house, and it will be easy, or it will be convenient for your wife to drop the kids to school, and in that way you will be able to come to the hospital for work on time. Okay.
Dr. Zahid,
Yeah.
yeah. Here, so Michael agreed for the support given by Dr. Jivanti. So here will we need to escalate the things here we will tell Michael that I want to escalate to educational supervisor or anything.
So I don't, sorry, the name is not there, but see if the things have come to you as a registrar, so it means that Michael is coming late for work repeatedly, and being a registrar, it's your responsibility. Here in UK, the things are very much fair. You need to be clean and fair. So if the things have come to you, so being a registrar, it's your responsibility that Michael education supervisor is aware of what is happening, because if anything happens later on, because you have already been involved by whoever the person is, either it's the nursing team or your other colleagues or the colleagues who are working with Michael who is suffering because he's coming late. So if you have not escalated the things, and later on the things goes to the education supervisor through someone else, and they say that, oh, some patient safety is compromised, and they say, oh, we discussed with Dr. Jevantika this issue 2 weeks back, and she hasn't escalated anything to you, or she hasn't done anything. So it will be a bad name to the registrar who has already been being informed. So being a person who has already been informed, it's your responsibility to escalate the things to the education supervisor. Like most of your thing, either minor or major, it will go to the education supervisor. Like if you cough in a wrong way, it will go to your education supervisor.
Okay, yeah.
Zahid, I
Dr.
have a
Sajid,
question.
yes, please.
Yeah, so after this is, I don't know, is it right to ask this question? But after this conversation, do we have to make a report and send it to education supervisor?
Sorry, record in what way?
I mean, this conversation after this communication, do we have to
So,
make report and send it to education supervisor?
no need to report, but you will tell Michael that, Michael, as the issue has been raised to me, or I have been aware of this issue and I discussed with you, but I would like to, I will be escalating this to your education supervisor so that he's aware of all the happenings. So you have to tell Michael that you are going to talk to your education supervisor. No need to write any report or any email. So you will just go to tell him that you are going to talk to your education supervisor so that he is in the loop and he's aware that what's happening.
Okay, thank you so much.
Someone asked, I is initiative. Being as a registrar, what support I can give to Michael, and what support I can give before things are supported from the department. So I is an initiative from our side. Okay. Anyone, any question? I know it was a bit of odd kind of scenario, but I see most of the candidates, they are going to appear in the UK, so that's why I included it. It might come, and mostly it is one of the common scenario, like Dr. Mazhar said. These things are quite frequently encountered here. So these things like you might face in the exam. So sorry for being putting such an odd scenario communication in the session. So no question. I think Dr. Arushi was the next name which was given to me. I don't know if she is here or not. No? Dr. Arushi is not here. So anyone who want to do the next communication, they're more than welcome to do it.
So can I try?
Yeah, sure, please. Let me go to the next one. So I don't know how to delete. So let me just explain. Dr. Fatma, SPICE is S is situation, P is patient safety, I is initiative, E is escalate, and S is support. So situation, when you are doing this communication, you need to know about situation which is making him coming late for work. P is patient safety. Whatever situation is happening, you have to make sure that patient safety is not compromised. E is initiative. What, as a registrar, if the things have been escalated to you, what initiative you can take that you can support Michael and you can make sure that patient safety is not compromised. E is escalate. You have to escalate the things to education supervisor and clinical lead or rota coordinator, depending on the situation in general. And S is the support, which as a department we can offer to Michael so that he can start coming back for his work on time. Dr. Tanu, I will start your timer, okay?
Okay, sir.
Yeah, 3 minutes. Ready?
Yes, sir. Can we start?
Okay. Yeah, sure.
Good evening. I'm Dr. Tanushree, one of the pediatric doctors here in this facility.
Good
Am I
evening, Doctor, how is Jennifer? Dr. Jennifer is so sick. She had this allergic reaction. Doctor, I'm afraid she will die. How is she doing now, Doctor? Doctor, no one is listening to me and no one is coming to help me. Doctor, please tell me, how is she doing?
Yeah, I'm here to address your concerns, Mrs. Wilson. And I can tell you that Jennifer is stable right now, and her her body is coping well now. Her BP is her blood pressure is stable. Her heart rate seems to be fine, and she has responded well to the medication that we have given her.
But Doctor, why
I-
this happened, Doctor? I'm afraid it will happen again and I will not be at home and she will die, Doctor. Like, this is like, why she's having this allergic reaction, Doctor? Like when coming to hospital, I searched about it on the internet, and they said that it might cause a lot of problem, and children might die from it. Doctor, I'm quite scared. I'm working woman. She's most of the time either she's at home or she's at nursery, and I'm scared she will eat something at nursery and she will have again this kind of reaction and she will die. Doctor, I don't know what to do. Doctor, please tell me.
I can understand your concerns, and I'm so sorry that you could not be here, but we are taking good care of her. We took good care of her when she was brought here in the emergency. And I can understand your concern about this reaction that she had. I'm here to reassure you that she just had a mild allergic reaction, and there's nothing to worry as of now.
Yes, doctor, but I was reading in the internet that it might be mild sometime, it might be severe. Like, I don't know why this happened. Like, she's 4 years, she never had an allergic reaction, and she's going to nursery and she's eating around a different kind of thing. I'm afraid that she will eat something, and as they said that there might be something called anaphylaxis, and it might cause a problem with breathing, and all his the baby's face might get swollen up, and in some severe situation they might die. I'm afraid that Jennifer will die, doctor.
Oh, since you have brought up the name anaphylaxis, let me tell you, anaphylaxis is actually an extreme form of allergic reaction. And as you rightly said, it occurs very suddenly without warning, but it is a life-threatening condition actually. But in this case, it involves more than one system. As you said, she could have swelling of the lips, tongue, she could have breathing problems, and she could as well collapse and lose her consciousness. I'm happy to hear that you are well read about this, but in Jennifer's case, it was just a mild reaction to something that she's had, and as of now, there's nothing to worry. But
Yes, doctor, but I was reading about the internet also that there is something called EpiPen, and you need to keep that at home if the kids they're having allergy, and in this situation you can give them these injection at home before bringing them to the hospital, and in some situation it might be life saving as well. So you are going to give me this EpiPen and I can take with me home.
I understand your concern, Mrs. Wilson. But as I've already told you, EpiPen is for this extreme form of allergic reaction, which we call anaphylaxis. And you would actually have to know when to give this drug. It cannot be just administered for a mild allergic reaction or a mild skin rash or something that does not require. Because the drug that is there in EpiPen is a drug called adrenaline. Have you heard of this medicine?
Yes, I read about it on the internet, but like as I said, like as you said, like it is given in severe reaction. But I don't understand, like see, Jennifer is completely fine, and she never had an allergy reaction to anything, and this is the first time. So this time it was mild, but I'm afraid that next time it will be severe and life-threatening. So what's the harm? Like if you give me this pen and I can keep them with me at home, like what's the what harm it will cause if I have this pen with home? I promise I will not use them unless and until I'm sure that it is something very severe, because I need to keep something at the school and the nursery as well.
Okay, I understand your concern, and I'm there to address them. But it would be, would you mind if I arrange a meeting with my consultant for you, where you could also ask him and clarify your doubts? And probably we could
Yes,
do
doctor,
that.
that will be wonderful. That will be wonderful, doctor. And doctor, I was reading as well, like there are some tests that can be done for allergic reaction. Like, can you refer me to the allergic doctor as well?
We have assessed your child, and as of now, she doesn't require any assessment or doing any allergic tests. And we will definitely refer you if we think she requires. But as of now, we do not think she requires this test. Am I clear on this?
Yes, doctor, it's like clear, but you are not listening to me. Like I asked for EpiPen, you said it's not needed. I asked you to refer me to this allergic doctor who can do some tests to make sure that she is not allergic to anything which might be harmful and which might harm Jennifer. And like, I'm so much scared. Like when I was in the middle of a meeting when my mother called me, 3 minutes remaining. when my mother called me that she's taking Jennifer to the hospital because she is having some redness on her face and her body, I left everything in the middle, and you said like you are not doing anything.
I understand your concern, but definitely we would not want Jennifer to undergo tests which are not necessary. We would only do them when it is necessary, or if we find that it is required for her diagnosis. And definitely I would arrange a meeting with our consultant if you have further doubts regarding this. And is there any other
Doctor,
concern?
I'm afraid Jennifer will die next time if this happened, doctor.
You are so much concerned, and I can really empathize with you, but you need not worry. We are there in any emergency. Can I just summarize what we discussed, Mrs. Wilson?
Yes, doctor. Yeah, that's fine. Yes.
Yeah, we had a discussion today about Jennifer, who was brought to us in the ER with a rash in her face, which was sudden in onset. And since we were not there, we had looked after her, and we had given her the necessary medications, and she has responded well to them. And according to observations, she is ready for discharge. And I also told you about severe allergic reaction that sometimes occur, which we call anaphylactic reaction. You had some concerns regarding this, and you were also wanting us to give you an EpiPen. And I have assured you that I will arrange a meeting with my consultant, with whom you can have a detailed discussion regarding this matter. Does it sum it up?
Yes, doctor, that's fine. Yeah.
So thank you so much for your time. I hope Jennifer does well, and you can keep us updated regarding her condition. And
Thank you
we'll
so
be.
much.
I can also
Yes.
provide you some. Leaflets, patient information leaflets, which you can go through, and you can understand what is anaphylaxis and when do we give it, and what's a minor allergic rash. And I can give you the links of some websites which in your free time you can go through, and you can keep yourself
Okay.
updated on this.
Okay, doctor. Yeah. Thank you so much. Thank you.
Thank you so much for coming. Thank you.
Yes, the time finish as well. So Dr. Tanu for being a bad role player, but yeah. Anyone want to add anything? I would say like Dr. Tanu, it was wonderful communication. Before
Thank
anything
you.
else, yeah. Yes. You explained what a mild reaction when an anaphylaxis, and yeah. Anyways, anyone want to comment or add anything? Dr. Mazhar. Yeah.
Hello.
Yeah, Dr. Sabah. Yeah.
Yes.
We should have asked. The mother was again and again saying that my child will die. She should, when she was again and again saying that, she should have asked why she has this concern. Is there any history, backward history, or any family history, or why she is again and saying that she will die? What
So,
was the reason?
yeah. So I told her already that it's the first time Jennifer is having this reaction. Like she never had an allergic reaction, and she had this reaction first time. And I read on the internet that anaphylaxis can happen, and for anaphylaxis, like it's severe kind of reaction, and we need EpiPen. So I gave her most of the things. So that's why she didn't. What I presume she didn't ask further details, because told her that yeah, she had never had such reaction, and this is the first time. So I presume that what might be running in the back of mind of Dr. Tanu as well.
Okay.
Yeah.
I felt the mother was more guilty because she was not there at the time when this happened, and she had to come later. So out of guilt, she was like responding in a. She was hyper. Actually, that is what came out as a role player to me.
Dr. Mazhar was saying something as well.
Yes, sorry, I have to miss some part of that communication, so didn't listen completely, so unable to comment.
That's fine. Yeah, Dr. Chinmay.
Hi. So
Hi.
excellent communication. Just one thing which I would like to add is that when the role player was saying that I read on the internet, and then you said that you would give some information about some websites. I think it would be nice to say that yes, I understand that you have read on the internet, and the internet is full of information regarding a lot of medical information regarding mild to severe reactions, but not all the information can be verified medically. So I will give you some information or some websites which are relevant, which are medically verified, and the information on that website is authentic and true to best of
Interested.
my knowledge. So something which can tell the mother in a very subtle way that what she has read may not be most accurate, and we don't know that everybody today has a mobile phone who can read thousands of things on the internet, but not everything is verified, and we would encourage that, but from a verified source.
Yeah. Yes, and Dr. Tanu, yeah, Dr. Tanu, in the end, she said that she will provide some leaflets and
Yes,
some
yes,
website. Yeah,
exactly.
you can. Yeah,
So
yeah.
yes,
Yes, and you can, like Dr. Chenmay said, that you can emphasize that I can provide some links which will be from the trusted websites, and they are particularly written for parents or the carer in a simple language, so it will be much easier for you to understand. So, I had my interview recently for one of the job, and this communication was there. And Dr. Tanu, when I started, I said good morning, and before I would say that who I am, the role player started that my child and all these things. So
Yes.
yeah. So when she finished, I gave her enough time. When she finished, I said, I can understand your concern, mom, but let me first tell you who I am. So I introduced myself that I'm Doctor this and this, and then I started, and it was then written by the examiner as well, that you listened to mom, and then you gave your introduction very nicely. So I try to proceed in that way, and you tackle the situation really beautiful. Like I would say, you did it much better than me when I was doing my communication at that day. You yeah, you tackle it very nicely. You listen to me, although like when I was doing it, it was camera on, so I was seeing the role player face to face. But in this, my camera was off, your camera was off, but whenever you heard that I'm trying to say anything, you completely paused your sentences, and you took a complete pause, and you let me speak. So I would say, uh, you are a very good listener.
Thank you, sir.
No problem. Yeah, Dr. Rupal, I think she want to say anything. Her mic is open since.
Yeah, so I think when mother is asking in future, it might be possible that Jennifer develop anaphylaxis. So we could give EpiPen for use after explaining how to use, when to use, what are the doses. So I think EpiPen we can give here rather than
So, yeah, yes, yes.
yeah. So rather than telling her, I will not give her. Though he tackle very good, he will escalate to things to consultant. But that was my question, whether we can use EpiPen or not.
So, actually, this communication I had done personally few weeks before. So, same what Dr. Tanu said, I explained to the role player what the allergic reaction your kid has and what anaphylaxis is. And then I said that in your kid condition, she responded nicely to the oral antihistamine. And it's just a mild kind of allergic reaction for which normally we are not giving EpiPen. So, because in UK, whatever you are giving, you have to think 100 of time that you are using the hospital resources. In other part, it's much easier. So, like Dr. Tanu said, she did rightly. She explained to me what allergic reaction my kid is having and what anaphylaxis is. And in her condition, EpiPen is not needed, because if we giving her EpiPen, we are misusing the resources. So this what I did in my communication when I was doing this few weeks back, and the examiner who were there. There were two examiners. They have written that you explain to the mom what allergic reaction is, what anaphylaxis is, and why EpiPen is not needed. So EpiPen in this condition, especially if you are in NHS, you will not give her EpiPen. You will discharge her on simple oral antihistamine, and that too if you are giving chlorpheniramine. If you are giving her something higher antihistamine, you have to ask her to go to the pharmacy and take over the counter cetirizine or something, which is a bit expensive. So in NHS, the thing is that everything is from public funds, so you have to think a bit more before prescribing anything from the hospital. But in this case, yeah, we are not going to give her EpiPen to take home. Yeah, Dr. Chin.
Yes, and to add to what you said, not just hospital resources, it's about guidelines as well. In the UK, we have very strict
Yeah.
guidelines. So if we prescribe something which is out of guidelines, then I mean, there may be somebody who is who is not in need of that. So so that will just give him a label of having serious anaphylaxis reactions or things like that. For example, if somebody who is not have who just has one seizure, and if we prescribe him on any anti-epileptic, so we label him as epilepsy. So similarly over here, the strict guidelines when to prescribe rescue medications, when to prescribe EpiPens, adrenaline, things and all of that. So we have to follow the flow chart of NICE guidelines,
yes,
which is very different from the rest of the countries.
Yes, and
So
yeah, here,
we have to
yeah,
go as per the algorithm. If it says a mild
yes.
reaction, no need of an EpiPen, we even if we think, even if we're confident with the family, we cannot prescribe.
Yeah, like here, I don't know if you receive a child with wheezes. So different areas have different protocol. Like if the child is wheezy, and if it comes to the emergency, like if I consider my experience in UAE, so if a child is wheezy and it's coming to used to come to the hospital in UAE when I was working, so they will directly put him on nebulization. They will start him on back-to-back nebulization. But here we are, if the child is wheezy and he or she is not needing oxygen, so we are going with the inhalers. We are giving them inhaler and we are checking the response rather than putting the child direct on nebulization. And then so like Dr. Tanvir, he said that, so it's all the protocol, it's different everywhere, and then also it depends from trust to trust. So if any patient is coming to me, if it's sick patient or normal stable patient, so if it's a wheezy child, I try to print. I have to print the wheezy child protocol. I attach that protocol to the child file, and then the nurses, they will keep on following the step. Like if the child is not on oxygen and I tell the nurses that give this child nebulization, she will not listen to me. She said, no, you are not following the protocol. Like in other part of the world, the nurses, they cannot answer, they cannot if you ask them something to do, they will not say that no, you are wrong or you are right. Here the things are completely different. Like if anyone, like if not I personally, if the consultant, even they are breaking the guideline, they are not following the protocols, the nurses will come to them and they will say, you are not following the protocol, so this is what our protocol is. So yeah, that is Dr. Chenmi said, the things are a bit different here as compared to the rest of the part of the world. So if you are preparing for the UK exam, so in this situation, yeah, you are not going to give her the EpiPens. Okay, any question or?
Hello,
Yeah,
Dr. Zahid here.
yeah.
Mother is asking again and again that in future any reaction can occur and I'll be at my office or about the investigations. So for that, what we have to reply?
So as Dr. Tanushi arranged a meeting for her with your consultant, so that's more than enough at your level to do. And if the consultant then he thinks that this patient need further investigation, then he will arrange this patient and he will refer him or her to further investigation. But all that you can do is arrange a meeting with your consultant if she's not satisfied from you, and to give her authentic source of like authentic patient information leaflets or authentic website where she can read what actually a mild allergic reaction is and what she has to do when she is away, and what information she has to give to her nursery or her grandma when such thing or such episodes happen in future. So at our level in exam, especially escalating to consultant and giving them appropriate leaflets, they are more than enough.
Thank you.
No problem.
If the mother
Okay.
said, what happens if what happens if my child next time has an anaphylactic reaction, she might die because of that. That's what
So,
she's.
yeah. So if in case she's saying, you have to explain to her what anaphylaxis is, what she can have. Like she might have swelling in her body, she might have a difficulty in breathing, you might hear some wheezes. So if you explain to her what actually anaphylaxis is, and in that case, if she's getting anaphylaxis, the first thing she has to do is to call the ambulance and bring her straight away to the hospital without delaying anything. So you have to update her, you have to give her information about what actually anaphylaxis is and what she has to do in case of anaphylaxis and what she has to do in case of a mild allergic reaction.
So
Is
calling
it clear,
9
Doctor?
calling
Yeah,
911 is the option if the child actually has
yeah,
one.
yeah. If yes, if in case this child Jennifer is having allergic reaction, anaphylaxis reaction next time at home, so she has to call the ambulance and she has to come to the hospital immediately through the ambulance. Okay.
Yes, sir. Thank you.
And
No
one
problem.
more question from my side, sir.
Yeah.
So
Yes.
here, the mother didn't know the cause. What is the causing allergy? So here, can we refer child to allergic specialist to do the allergy test?
So your consultant, she will review Jennifer again. But if the mother is continuously insisting and she's not listening to anything, what happened in my communication? She was continuously insisting. So I told her, okay, as you are worried, I can refer you to the allergic team, but it will take time. It's not something which will is going to happen very urgently. So you would have to wait for the appointment. So if in case the mother is insisting, you can tell her that, okay, I can refer you to the allergic team, but it will be on a routine basis and it will take its time. So if there's a situation, you can reassure mom, because if in case something happens in future later on, if you talk about real life situation, so if in case Jennifer get an anaphylaxis reaction, then mother say that I asked the doctor last time that refer me to the allergic team, or give me EpiPen, and she didn't listen to me, she didn't refer me to allergic team, she didn't give me EpiPen, and now see my child is having anaphylaxis reaction. So if in case the mother is asking you, you can make a referral, or make a referral to the allergic team, and just tell her that it will be on the routine basis and she will get the appointment or the letter once her turn is up or her number is due. Okay,
Yeah.
Dr. Rupal?
Yeah.
Or
Thank
we
you.
can say in a way that consultant after meeting with consultant, my consultant will decide for the referral. We can say in that way too.
Yes, that you can, like, yeah, in the exam situation, you can say that, yeah, let me arrange a meeting for you with my consultant, and he will sit again with you and he will explain to you, and we will decide about the next step of management after having a discussion with my consultant.
Okay,
I think Dr.
thank you.
Rupal, you were the no problem. Dr. Rupal was the other volunteer, I think.
Yes. Sir.
Yeah, you are ready.
Yeah.
Yeah, this is your communication. I will start your timer. You can prepare it.
We can start now, sir.
Okay, sure. Just let me, okay. Let me reset the timer. Yeah.
Okay. Hello, good afternoon. My name is Dr. Rupal. I am one of the registrar here. You must be Jessica.
Yes.
Hello. How are you doing, Jessica? Is this right time to talk to you?
No, doctor, it's not the right time. I want to go. Why you are keeping me here?
Yeah, Jessica, I heard that you are going through a lot, and I'm very concerned about you. So that's why I'm here.
Doctor, why you are concerned? I'm not concerned about myself. I want to die. You are saying you are concerned about me? Life doesn't mean anything to me, doctor.
Okay, Jessica, it must be hard for you. So would you like me to tell what's why do you think so? Okay, Jessica, so here I am here. I know you don't want to talk to anyone, right? But here I heard a lot about you. You are doing so well in your school, and I just want to know what happened to you. Why did you take this big decision to take the paracetamol?
Because I want to die.
Yeah, so may I know reason why you want to die?
Doctor, why shall I tell you?
Yeah, I know I'm very strange to you, but I am for you here today to talk to you regarding what's going on. Why do you think so? It it will give me a pleasure if you want to share your feeling with me.
No, doctor, I don't want to share anything with anyone. Just I want to go from this hospital. Please let me go.
Okay, so why you don't want to live here? Why you want to go home?
Doctor, my boyfriend left me.
Oh, I'm so sorry to hear about that. So,
You are sorry as well. So that's the reason I want to kill myself. Even you feel sorry for this. So why should I
yeah,
not be sorry for that? Like I don't like Doctor. I'm fed up of this life. There is nothing left in this life for me. I want to kill myself. Please, if you didn't let me go, I know how to escape from this hospital. I know the ways from this hospital. I've been coming to this place since I was a kid, so I know the routes from where I can escape. So if you want to let me go easily, it's fine. Otherwise, I will run away from here.
yeah, I understand your situation, Jessica, because I've also gone through the same situation. So I can understand what you are feeling at present. So, but trust me, if you want to live, then there are so many options afterwards. Because ending your life, it knows the solution here, Jessica.
So what's the solution, doctor? What do you say? What's the solution?
Okay, so here you take the paracetamol, so it can harm your body. It can lead to the failure of liver. So
Yes, doctor.
at
Yeah,
present,
I want to kill myself. So I don't. It doesn't matter if anything fails or if pass. So it doesn't matter for me. In like, it's fine. That's the reason I took all this. I took all these steps. I took the medicine because I want to end my life.
yeah, I know you are feeling very low at present, but trust me, if you allow me to do treatment, I will give you so many options, and I can reassure you your life will be great ahead, because ending your life just
So,
for one
doctor,
person.
you mean you can give me option? You can find me a new boyfriend, or you are going to talk to my old boyfriend and bring him back to me?
Yeah,
He's
we
now my
can.
best friend boyfriend now. He's now my best friend boyfriend. So even my best friend cheated me.
Yeah, I
What
know
option you
it's
can give
very
me,
hard.
doctor?
Hmm.
What kind of
I
option you can give me?
Yeah, so I know it's very hard to take up all this situation. So I can make an arrangement for you with your school, and I can make an arrangement for any social worker to help you, who can help you to tackle with your situation. You can take support from our team. You can talk to them.
I don't know, doctor, what you are saying about schools and about social service. I'm not in getting all these things, and then I'm not at all interested in all these kind of discussion. See, you asked me to share with me your feelings and why I took this. I told you, but I'm not getting any support now.
Yeah, I'm
I was
happy that
expecting
you
that after
opened up.
listening all these things, you will let me go from here, and you will let me go from here easily. But still, you are talking about all these things, the social services and the schools. Uh, I'm fed up of all these discussions.
Yeah, I know it's very hard for you. So that's why
3 minutes
I
remaining.
want to give you as much as support I can give you. So escaping from the hospital and not taking treatment is not the solution, right? Because you have so many people other than your boyfriend surrounding you who might needs you.
Nobody needs me, doctor. Nobody needs me. I know nobody like me. Nobody love me. Even my best friend, she cheated on me. So I don't think so. There is anything left for me in this life.
Yeah, I know it's very hard. So, but I am happy that you said your feeling with me, and I will not tell anyone. But if you agree to the treatment now, so we can find out the solution. We can try to ask your boyfriend. We can there are so many solutions. We can discuss it later on if
But
you
doctor, I don't
want.
want to see his face anymore now. I don't want to see his face. I don't want to see my best friend face. I hate them now.
Oh, so that is a very good. So you can have another boyfriend, which is far better than your ex-boyfriend. So that you can also show them you are not bad. You know. So
Yes, doctor, I
why
don't
don't
know.
you try?
Yeah, I don't know what to do. I'm so tired. I'm done with all these things.
Yeah, trust me. I'm happy you shared all these things. So trust me once again, so that I can proceed with my treatment, and so that I can help you furthermore.
Okay, doctor, that's fine.
Okay, so that is so nice of you. Thank you so much, Jessica, for talking to me today. I'll make sure you will get better soon, and we will find new boyfriend for you.
Thank you so much. Thank you, Dr. Roper. Sorry. Okay. Just yeah. Sorry, Dr. Rupal. Yeah. Okay. The time is finished also. Yes. So yeah, Dr. Rupal, how was it?
I don't know how to start, and how can I say. I know I didn't tell anything regarding what is the treatment, what are the complications for that, but see, I don't want to take treatment,
Yeah.
so I tried
Problem. Yeah.
as much
Yeah.
as possible to
Yeah.
agree her.
The problem with these teenagers in in real life, they are much more difficult than they are in the communication. I would say in the communication still, in the exam they are cooperating with you. If you are polite with them, so they will share with you like why they took this, why it's happening. Very rarely that they will refuse for the treatment and everything. So one thing you said, I'm passing through same thing what you are passing through. So that time I start like uh, it was a bit funny for me. There's like when I said like my boyfriend left me, you said yeah, I'm passing through same thing what you are passing through. And then you said I will give you some options. So these things were, yeah, I wanted to talk about. But before we can talk, anyone want to comment or anything? The teenager in real life, they are much more worse than they are in the exam, I would say. Last time when we were doing this communication, before that we had a teenager who came with paracetamol overdose and self harm, and she was completely mute. She was not talking to anyone, and she was preferring to be communicated through writing. Like, you will write something to her, and then she will reply back to you after writing. So, and problem with these teenagers, they remain inpatient for weeks until and unless they have been reviewed by KIMS and they have been labeled medically fit from them, and then they have some safe place at home or safe place wherever they are going. So sometimes their stay is for weeks in the hospital. So every day you have to face them, but the days, as the days pass, they get used to the things, and yeah, then they are a bit more cooperative. But initially they are very difficult. Anyone want to comment anything?
Yes, it was a very tricky situation, and it's quite common in the UK or surroundings. So, yeah, you're right that you don't compare yourself with them like you did that. I am also feeling through that things. So I think keep these things a bit apart. And one thing more, that don't offer those things which are unable to get. Like, be
Bringing the
always
boyfriend.
truthful. Yeah. Be always
Yeah.
truthful to them and honest. I know you can't get any boyfriend for anyone, so it's very difficult. It's just so, really, I was laughing a lot during this conversation. It's one of funny conversation, but always come to the point. Always polite. That you are excellent at it. You tried
Yeah.
your best. You try your best to be as polite as much, and you was very empathetic to her. It's a very good thing. Just work on the things, that always be honest and truthful to them. Don't give false hopes.
Yeah, and yeah, Dr. Ropa, like for everyone, once like the teenager, they started sharing with you their feelings. There's the time they are melted. So it is the time you have to throw your ball to them. Like Jessica, so let me finish this. So let's Jessica, see, your boyfriend left you. He is enjoying. There is nothing which can be done. So let's focus on your treatment at the moment. Let's make you feel better, and then you can proceed your life, and you can live a good life. So once, like, at the point they started to sharing with you, at that point you have to take their confidence, and you have to convince them that what's good for them. Like, their boyfriend have left, or if they have failed their exam, or something bad have happened, so that's already been happened, that cannot be reverted. Why you are giving up your life for someone who doesn't care for you? If your boyfriend cared for you, he would have never left you. Or your best friend, who was in real life your best friend, she would have never cheated on you and being your boyfriend's girlfriend. So you if they are not sincere to you, so why you are giving up your life for someone? Try to focus on your life and try to proceed further. Yeah, but yeah, don't offer them to look for a new boyfriend from our side, because it will be the most difficult promise, I would say, like Dr. Mazhar said.
Yeah.
Yes. And Dr. Mazhar, is you are working in Ireland, so I think UK, Ireland, all the Europe countries, they are more or less the same. So these things
Yeah,
you
yeah,
will be
yeah.
facing. And yeah, so uh, in real life, and especially if you look into heads, I know most of you know about heads as well. Home education, activities, or alcohol, diet and drugs, self-esteem, sexuality, and safety, and suicide. So yeah, in teenagers, if you are taking any history, especially, try to think about heads always, and explore all the headings.
And one thing more I will add, if you have encountering a girl and you're a male doctor and she's a teenager, like 16 years, you must ask that I need, if you are even taking the history, and you should that I have the nurse as a chaperone with me. Ask her if her parents are around, so someone from her side
should be there, or I think if even in communication, you definitely patient is in the emergency or ED or in the ward in the cubicles. In that situation, you must bring the chaperone with you, and you can ask that I
Yes,
need chaperone to the examiner,
yes,
because
yeah,
you know that there is maybe at that area you need that chaperone. So keep in mind, an examiner must know about this, that you know it.
yes, yeah. And a very good, Dr. Rupal, you didn't introduce yourself as a pediatric doctor or a children doctor. Whenever you are talking to a teenager, you can introduce yourself like I'm a registrar or I'm one of the doctor in trainee. Don't ever use the word that I'm a pediatric doctor. I'm a child doctor, because the problem with these teenagers, they think that they are grown up and they are now more from the pediatric population. So you did very rightly in the introduction that you are one of the registrar. So you can say you are one of the registrar, or you are one of the doctor in trainee, or you are one of the doctor. So that's more than enough. Try to avoid the word pediatric or the children doctor whenever you are dealing with the teenagers. Okay. Any question from anyone about this communication or the previous ones?
So I could not follow what was said just earlier about this communication.
Sorry, can you repeat the question?
I could not understand what was said about parents being present or something like that.
Yeah. So, like if you are a male doctor dealing with a female teenagers, or if you are a female doctor dealing with a male teenager, try always, like in the exam or even in the real life, try to take someone with you to be present when you are taking history or when you are doing communication, because they are quite vulnerable people. They might blame you for something. So whenever you are going to them, try to take the nurse who is looking after that patient with to be with you as your witness. That was the point raised by Dr. Mazhar. So you and when you are in the exam situation, you have to tell like Jessica, the nurse who is looking after you will be with us in this communication. Is that okay with you? So because in exam it's all drama. So just to reassure the examiner that you know that you need to keep someone with you as a witness, so you can say these things.
Yes, because there are few cases with the Pakistani doctors in Ireland that the teenager, they alleged that he has harassed me or these things, and now they are in the court with IMC, Irish Medical Councils, and their future is at stake at the moment. So all the seniors are constantly telling us to do these things, and also to buy the clinical indemnity. So that's why it's very important nowadays in these countries, and because they people know that here in these countries, they know that these Asians, they are the more vulnerable. So that's why it's a safety measures.
So Dr. Asma is asking about head. So head is basically for teenager when you are doing history, but about the communication bit, if in case you are trying to getting their confidence. So if in case they are not getting involved with you, so you can start with like Jessica, let's talk about your homing, let's talk about your education. So somehow to know what's the cause for her overdose and get her attention and get her uh confidence in you, that she starts sharing with you. So at that point, if she's not getting involved with you, then you can bring heads in communication as well. You can say like Jessica, let's talk about your home, how your homing is. Let's talk about your education or activities, or in communication. Yeah, if you think you can talk about drugs and alcohol, but it's very rare. It is more of a history bit. Suicidal, if she's hasn't volunteered anything so far. So Jessica, do you mind sharing with me why you did this, why you attempted to take paracetamol, or why are you attempted to kill yourself? But try to be polite and try to reassure her that, Jessica, let me reassure you that whatever we are discussing today, it will remain between us. I will not share this information with anyone. I'm taking all this information just to offer my support to you, and I can see that what I can help you with it. So just whenever you are doing anything, try to reassure her that whatever information she's giving to you, it is just will be remaining to you, and you are taking the information so that you can support her and you can help her.
What do we do when the teenager refuses to talk, just doesn't talk or doesn't respond? How do we
Yeah,
bring it?
so if it's an exam, keep talking. Then it's the most worst scenario which you will be facing, you have to continue on talking for the 9 minutes. And if she is not talking at all, so that's what has been fed to her from the Royal College, that she need to be completely mute. She will not be completely mute. She might be just nodding her head, or she might be doing yes or no, yes or no. But then it will be your responsibility to finish this communication and complete this for 9 minutes. And it will the most worst scenario if you are facing that, and you will have to talk for the complete 9 minutes from your side. And I don't think they will be bringing, because it will be very difficult to continue on talking for 9 minutes without taking any information or anything. But anything can happen. It's the drama exam.
In one of our lectures, we were told in teenagers, if we say if you want anyone else to be with you, they get offended, something like that.
So you can just say like you would like your nurse who is looking after her to be with you. So is it okay? So because it's an exam, you are not bringing someone in real. So you have to show to the examiner that you are keeping yourself safe, and you are making sure that there is someone witnessing all the discussion which you are going through. So you can just tell her, is it okay, Jessica, if the nurse who is looking after you stay with us during this discussion? So she will, if she say no, that's fine, but you have offered, the examiner has noticed that you offered her someone to be with you. Okay.
What to say when the role player says, I don't want to live, and no one cares about me, and I don't want you to care about me as well, and something like that. Why are you
So
taking
if she's saying, if she's saying like this, so you can ask, Jessica, do you mind sharing with me like what made you think like that nobody's caring about you, or life doesn't matter anything to you, or why you think that I'm not helping you? So do you mind sharing with me what's the reason behind that, or what's the point behind that? So if in case she start talking to you about something, so that means that she want to volunteer with you to tell you something. So if she's saying that that doesn't mean anything to me, or life doesn't mean anything to me, or you are not taking care of me, then you can ask her that what made her think so. So if you ask her, and with that also just add a phrase that whatever conversation we have today, or whatever we discuss today will be with us, with us, and I will not share with anyone. So do you mind telling me? So if she's starting to talk to you, means she's volunteering something, then you can ask her that why she think like this is this and this is that. So you can ask her politely.
And about the threat that she says, I'm going to run away.
So still she's a 16-year-old. By law, she cannot like in real life, if I would say, like if she is not at all listening to you, then you can say that Jessica, I can understand you're a grown-up girl, and we try to consent you for treatment, but as you are not listening to us, and you are not giving your consent, I'm afraid that I would have to escalate the things to your parents. This I'm talking about real life. It will very rarely happen in the exam limit. I'm afraid that I would have to escalate the things to your parents, and I would be taking consent from them. About absconded, you have to call the hospital security. If in case she's threatening, you have to call the hospital security, and they need to be in the premises to restrict her from running around. Apart from that, all our adolescent child and adolescent wards in which we are keeping these patients, they are access restricted. Like no one can enter the premises without access card. Like if I'm entering as an employee, if I'm working there, so I have special access. We have special ward for this patient, and this special ward has special access. Not even the security persons, if they are entering the ward, they cannot use their card. They have to ring the bell, and we will open the door. So uh, very rarely in real life they are able to escape from the ward, but still possibilities are there. Someone is escaping, someone is going out of the door, and they run from behind. But all you can do is that you have to keep the hospital security to make sure that they confound her from escaping, and they secure the premises.
But can we actually restrain the patient? Because supposedly if she's already escaped, then we inform the hospital authority or hospital security to bring her back if she's still in the premises. But
if she escaped,
if no,
so
I mean to say, what I meant is like, is it possible to restrain her from going? Like, I mean, keep her like within the confines, keep her confined to the room, or is that possible?
definitely it is possible. But if in case she escaped, so then it will turn like it happened. One of patient came to our hospital with self-harm to the emergency department. The security team, they were trying to restrict her from going out, and then somehow that patient managed to escape from the hospital and ran away from the hospital. Then we had to escalate the things to the police as well, because once the patient is out of the hospital premises, hospital compound, then our security cannot do anything. And then to make sure that patient is safe and other people are safe as well, we escalated that issue to the police as well. But in real life, our security, they have to make sure that they will not escape from the place. Okay, any question or any worry from anyone? No.
No questions, sir. Thank you.
Okay. I hope you guys enjoyed the session, and it was quite interactive. I would say thanks to Dr. Mazhar as well for all his input, and thanks to everyone for attending it. See you guys some other time then. Take care and bye.
Thank you, sir.
Thank you so much. Take care. Bye.